Dear friends and my dear doctors, greetings from SAS Foundation. I am Dr. Bose. On behalf of clinics in chest medicine India, I welcome all of you in our upcoming conference, CICM India Chapter 2 at India Habitat Center, IHC Gulmohar on 5th November, Sunday. Please be on time. I understand you have all filled up the Google questionnaire. And this is going to be a very interesting update. And CICM India is basically a forum for young pulmonologists and all active pulmonologists, those who want to practice pulmonology as a total specialty. This conference is unique in the sense because we have tried to incorporate all those topics which are very relevant in today's and tomorrow's in pulmonology. And the best part of it, we have tried to bring a lot of new areas in pulmonology, which is very relevant in the days and years to come. Now let me read out the total itinerary, what we have decided. We'll start around 10 o'clock. Be on time. The first speaker is Dr. J.K. Sani. He's a very senior pulmonologist from NTRD, New Delhi. So he is going to speak about tuberculosis diagnosis, overcoming current challenges with modern solutions. Friends, you will agree, tuberculosis is still an enigma. Many times you know it's tuberculosis, but you need certain solutions, certain diagnostic tools by which you can confirm it, because simply routine sputum examination or bronchoscopic evaluations of cultural sensitivity is not enough. Sometimes it is delayed. So basically we are talking about how the modern solutions can really can help you to understand your clinical tuberculosis much in a better sense. So what we are going to talk about, the molecular biology, genetics and sequencing, which is very relevant and which is a very novel approach for early diagnosis of tuberculosis. So a lot of molecular tools and diagnostic tools which is relevant in this part of the world, we are going to talk about it. Then we are going to have another very interesting speaker, very young, very bright pulmonologist, Dr. Tejas Suri, and he's going to talk about wearables and nearables in sleep technology. Dear friends, the sleep disorder medicine has gone leaps and bounds, and ever since we have developed certain, technology to identify the sleep problems at the bedside. So now these wearables and nearables which you place near your body and what you wear, this can be very unique to understand the sleep disorders which you go through, during sleep. So these devices can accurately monitor sleep stages and disorder in a home environment. Their benefits and limitations are going to be discussed, and this is going to be very interesting because this area of wearables and nearables is the tools of the future. So Tejas Suri has a huge experience in stool. He's son of Dr. J.C. Suri. He was going to talk about the wearables and nearables and their benefits and limitations. Then we have a very brilliant cardiologist and a very well-read Dr. Tushar Roy. Though we know in cardiology we are talking about coronary syndromes and other things, but in today's pulmonology, one of the very interesting cardiopulmonology disorder is called cardiometabolic syndrome. Now, cardiometabolics, ever since the society is going little obese, a lot of lack of activity and insulin resistance, and India being a diabetic capital of the world. So I thought probably it's very important we should talk about cardiometabolic syndrome, a threat to cardiac health. So cardiometabolic syndrome, in a nutshell, what is called CMS, involves a group of interrelated abnormalities focusing on obesity, dyslipidemia, hyperglycemia, and hypertension that increase the risk for cardiovascular disease and type 2 diabetes. And cardiometabolic syndrome can present as cardiorespiratory failures, and it's really challenging, and many times they have sleep disorders. So it's a very interesting disease in the form of a syndrome, which Dr. Tushar Roy will be discussing about it. Then, of course, we have a very interesting area by Professor J.C. Suri. He will be talking about rationality in asthma biologics. Asthma has different phenotypes and genotypes, and as we always say, one suit doesn't fit all. So does asthma biologics benefits and justify high cost? This is a very important area because now this is a decade of biologics, but biologics are expensive. who are these people, who are this cohort of patients who needs biologics, he will be discussed. So adequate evidence demonstrates that all current biologic therapies for asthma related to type 2 inflammation reduce the asthma exacerbations and modestly improve the quality of life when rationally followed a treatment algorithm. So what I'm saying, rationality means you have to follow the right algorithm, you have to see the clinical correlation. If you rule out other important causes like upper respiratory, poor adherence and everything, once you rule out every possible thing, probably one subset of population who are refractory to asthma management, they are the people who need biologics. Dr. Joshi Suri is the right person to talk about it. He has a huge experience on biologics in asthma. Then we have my dear friend and part of our CICM initiative, Dr. Vikram Sarabhai, one of the finest orators in pulmonology. He is the one who is going to talk about this new tool which is changing the field of medicine, and especially in pulmonology, artificial intelligence, breath of new life in pulmonology. As you all agree, youngsters, AI, particularly using deep and machine learning, has a numerous potential application in pulmonary medicine, whether image analysis, sleep disorder algorithm, decision making, prognosis, and prediction. So Dr. Vikram is going to talk about how AI can be a very useful tool in enhancing your pulmonology practices. So please be on time because this is going to be a very interesting session. Then we have a very senior person, my dear friend, Professor Rajkumar. He's the director of Patel Chest Institute. He has a huge experience on immunotherapy. So we have this is the topic. What we have kept it is around 12 o'clock, 12 to 12:25. Therapeutic vaccines. Does allergic immunotherapy, AIT, work in allergic disorders? So who are these people who needs immunotherapy? AIT has advantages and disadvantages in its use, but with new technological and molecule strategies, safer AIT is developed with better routes of administration. So, though immunotherapy is a boon, but the right kind of patient selections with the right kind of strategies we follow, this can be really be very enhancing. So Professor Rajkumar will be talking about it. Then we have post-noon. That is the most important area. We have a very senior teacher and respected Professor Ravindra Kumar Diwan. He is the director of NITID, and he will be with Dr. Gayatri, who is our academic partner from Forts. Dr. Gayatri is a trained nephrologist from Harvard, and she also looks up to the Forts Pharmaceutical. Myself, Dr. Vikram, and our General Secretary Shushmita Rao will be with Professor Diwan and Professor Rajkumar for a limelighting ceremony, and where we have certain important areas where our General Secretary Shushmita Rao will talk about the book, the manual on COVID. COVID was a huge challenge, and thankfully, with the grace of Almighty, our whole team worked through and through in the COVID. We have very interesting experiences, and we have come out with a manual on COVID. We have documented our own experiences, our own images, and how we have worked, what is the role of rehab and all. And thankfully, with the God's grace, we have got an ISBN number. This is a very much is registered number we have got. It's a recognized book, and it has already been sent to different important libraries in India. So our General Secretary will talk about the book, Manual on COVID, a comprehensive patient-centric algorithm-based postgraduate manual based on our experience and recent literature. So it is not like a regular book. It is a very simple, based on images and algorithm we have make it. And I'm sure doctors will love it. Then we have Dr. Gayatri from Forts. She will be talking about the CICM initiative. Let me tell you, dear friends, we started in 2019 in pre-COVID time. We started in Meridian, India. It's New Delhi, Hotel Meridian. And since then, we have been doing regular workshops, webinars, community initiatives. We have written already 2 manuals, one for manual for chest disease, one for manual for respiratory care practitioners. We are very active in all forms. So she will be talking about our journey. And I think you should be there to understand journey, how we are connecting doctors. It is not a run-of-the-mill conference. We want to connect the whole pulmonology fraternity so that you can express your ideas, you can be a part of the initiatives. And here she will be talking about a journey from innovation to evolution. And let me tell you, dear friends, we have a very interesting website, Clinics in Chest Medicine India, CICMindia.com. Go to the website and see you can be an active member. If you're a member, you get a lot of advantages. You can enjoy the fellowship courses, which will be starting shortly. We have got module-based fellowship courses. You can share your cases. You can avail certain support services from the CICM, and you can be a regular part of our knowledge dissemination partner. So don't forget to register for active membership through our CICM portal, CICMindia.com. Then we have a lunch time. After that, we have another very interesting and a very senior consultant, Dr. Animesh Arya. He's a senior consultant pulmonologist at Balaji Action Hospital. He will be talking a very interesting areas. As you know, spirometry has a limitation, especially when the effort is poor, and many times you cannot assess in children population. So force oscillation technology, FOT, the future of pulmonary function testing. Dr. Animesh Arya will be talking about it. So he's already working in this area very effectively. The force oscillation technique has been used to measure respiratory system impedance in children and in adults. Oxidometry, being a tidal breath based techniques, can be a real privilege to physicians and their patients for monitoring lung function. It is more sensitive in detecting small airway pathology than conventional. So in a small airway disease, early small airway disease, you can use FOT. And for the children, since it is a normal tidal breath, in children in asthma, it's very useful tool. I think FOT is going to play a very important role in modern pulmonology. Then we have around 2:30, we have another dear friend of mine, a very senior pulmonologist and principal director of Fortis Memorial Hospital, Gurugram, Dr. Manoj Goyal. He's lot into intervention, and he's going to talk about his experience with EBUS, radial pros EBUS, for the diagnosis of peripheral pulmonary lesion, diagnosis, yield and safety. So radial probe EBUS showed a very good safety profile and a high diagnostic yield for peripheral pulmonary masses and nodules when compared to CT guided techniques. So he's going to share his own experiences with radial EBUS. Then the most important attraction of the conference, we have taken a good time for it. As you perhaps must be aware that our SARS Foundation is very active in pulmonary rehabilitations. We have done more than thousands of rehabilitation in chronic lung diseases. So this is an area which will be headed by Professor M.K. Sen and Dr. Chandola. He's a lung transplant surgeon from PSRI Hospital. And with our own team, Dr. Siddhant and Dr. Pratibha, this whole 4 people will be talking the rehab in pre and post lung transplantation. Every breath is a gift. This is a very important area. When you have an end-stage lung disease, when really with optimum therapy it doesn't work, then that is an area we have to work for lung transplantation. This area is really growing in India. So lung transplantation is going a widespread acceptance as a preferred therapeutic option for selected cases of end-stage lung disease in India. The indication of lung transplantations are increasing with better post-operative survival, including COVID-affected lung, if we choose our patient well. So right patient selections, and the most important in lung transplantation, the right rehabilitation. See, we are going to have a hands-on pulmonary rehabilitation with our team of people. See how we do rehabilitation in chronic lung diseases. That will be really enhancing for you. So we will have a very interesting session. Then we are going to have another very senior, my dear friend, a Professor UC Ojha from ESI Hospital, New Delhi. He's been working on environmental pulmonology, and climatic change is a huge problem. So he's going to talk about the climatic change for pulmonology is the silent enemy. The pulmonologists, we must acknowledge the burden of illness and take steps to assist patients proactively to prevent and minimize the adverse effects of climatic change in air pollution. Dear friends, you all know we are a little coughing. There's a lot of post-nasal drip. The climate is changing. When the winter comes, the pollution sucks, and the climatic change is the most important thing in vulnerable patients, which causes bronchial hyperactivity. So how the climatic change for pulmonologists, the silent enemy, he's going to talk about his experience as an environmental pulmonologist. Then we are going to have a very young Professor Rohit Kumar, from very well-read person from Cente Hospital. He's going to talk about the most important area of innovation, you can say, the last decade of pulmonology is NIV, non-invasive ventilation. When, whom, how, and when. The non-invasive ventilation has gone beyond ICUs. We are using in home-based therapies. We are using in intensive care. We are using clinical setups. So what is going to talk about the home NIV? Because the home NIV is going to play a very important role in long-term care, in chronic care, in rehabilitation settings and all. So home NIV in selected group population has become a well-established form of therapy over the last few decades. So he's going to talk about what are the guidelines of home NIV therapy, who are the people, what are the criteria we have to follow it, because most of the home NIV therapy are unattended or adult care professionals are looking into it. So what are the do's and don'ts he will be talking about? He has a huge experience on NIV, so Rohit will be talking about it. Then we have got another dear, young, very bright radiologist from National Heart Institute, where I'm associated. Dr. Anshika Gulati, she is our head of the department, amazing. What we are going to talk about is very interesting. It's like, we thought probably why not we pick up two interesting cases. It's like a hands-on. What we are going to show, two interesting cases. And through CT, we are going to explain how beautifully this we have diagnosed in and what are those CT, parameters we should look into it. So come to the conclusion. So the first case is a 55-year-old with a sudden dyspnea and cough pain, an imaging approach to acute thrombopulmonary embolisms. Here it came, this man came with a cough pain and breathlessness. So it turned out with pulmonary thromboembolism. And what are the CT changes happen and how you can assess the CT scoring, that she's going to discuss. Second case she is going to discuss about 63-year-old, a rare presentation of vocal cord palsy. There are so many causes of vocal cord palsy. She is going to present a very interesting case of vocal cord palsy with hoarseness of voice. These are very interesting areas. So my dear friends, don't come selectively for one or two, topics. You see, as we grow at the end of the day, the topics are getting more interesting and that is becoming more enhancing. And the last topic I thought probably I'll take, because the COPD has become a syndrome. It's an umbrella disease. As in once upon a time, we used to say if you read syphilis, you know the whole medicine. Now we said if you read COPD, you know the whole medicine. So we are going to talk about COPD in a different direction, because the Gold report in 2023 has totally changed the definition of COPD. What are the important updates and revisions? And that's why I'm going to talk about treat the disease as a whole, not as a simple hole in the body. So 2023 Gold emphasizes a new definition of both COPD and exacerbations, with former designed to more inclusive and latter to be more functional for a clinician. The most substantial changes to therapy are creating an E category group, as you know, for emphasis on LABA and LAMA combination for most patients and minimally using ICS. So we are not supposed to lump the disease like all breathlessness are like one disease. We are supposed to differentiate from COPD from asthma. So I'm going to talk about how we can treat the disease as a whole. Then, of course, throughout the conference, we give you a lot of ample opportunity to interact with the patients. A lot of time is there for networking. So young doctors, pulmonologists, active pulmonologists, anybody who's interested in serious pulmonology, fix this day, don't move out, stay whole day, interact with us, be in touch with our great teachers and professors, and enjoy this academic feast of clinics in chest medicine. And we have a lot of interesting news to share with you, and see how beautifully the manual on COVID has been written. And don't forget to become a part of CICM member through our website, and through website you can get a lot of information. So for any queries, we have a lot of group administrators here. Let me name you our conference general secretary Shushmita Roy. You can be in touch with her. Your number will be there. You can with our our joint secretary Dr. Pratibha. Her number is also there. Aditya is our associate. His number is also there. Vikas from Forts, his number is also there. But otherwise, you're free to chat with me or talk to me, or you be in touch with in any form. I'm always there for you. Don't hesitate to call me or give me a call, or or chat with me on my number 98101 59687. I repeat again, 98101 59687. Looking forward to meet all of you. We'll have a lot of interesting discussions and we'll have lots of fun. Wish you a happy Diwali in advance. Take care. Regards, Dr. Bose, founder of CICM India.